Assalamualaikum dear students. My name is Dr. Hira and I'm your course instructor of therapeutic exercises. So, as you know that we are discussing about the resistance training and before that, as we are following the sequence of the chapter, so there are a number of topics before starting or before talking about the resistance training regime. There were certain topics that we are discussing in the that we have discussed in the last lecture, and few are left, I guess. And afterwards, we will start with the typical resistance training regimes and the resistance training related, uh, some terms that are specific to the resistance training. But before that, in the last lecture, let me recall you. That in the last lecture what we were discussing, we were actually discussing that how the muscle performance or how the muscle strength it increases and it decreases through your passage of the years. That if in the first decade what is your muscle performance, how your muscle is adapting, how your muscle is growing, and then after as you pass your puberty then into the late adulthood till late adulthood, what were the changes that we have seen in the last lecture. Moreover, we discussed about the fatigue, that there are two types of fatigue. Muscle fatigue was there and full body fatigue was there. So these were the things we discussed in the last lecture. Plus, we saw about the muscle fibers type and how they resist to fatigue. So, skeletal muscle function and adaptation to resisted exercise and physiological changes in the muscle development and muscle fiber types and resistance to the fatigue were the topic that we discussed in the last lecture. And in today's lecture, we are discussing physiological adaptations to resistance training program. That means that how the musculoskeletal system will adapt to the resisted exercise. Definitely, there will be some changes that will be induced by usage of a resistance training program or by using some training regimes that changes the physiological changes into the muscle, into the nervous control, and into the metabolic control that will eventually adapt our muscles. So, what will be these changes? We will see them in the upcoming portion. Also, we will discuss about the determinants of resistance training program. What are the determinants? You are very much familiar with the determinants. They involve the intensity and the exercise frequency, the exercise prescription, are the things related to the development of regime of the resistance training. So let's start with the today's lecture. Uh, so Bismillahirrahmanirrahim. Let's discuss with the strength training adaptations, that what are the muscular changes, that they can be anatomical or they can be physiological as well, that can lead to development of an adaptation of the skeletal muscle system, and the muscle will eventually how the muscle will eventually adapting the benefits and the effects from the resisted exercise in the chapter. As we are following the sequence of the chapter and everything from the chapter, so they are comparing the strength training adaptations with the endurance training adaptation. But as we are discussing only the resistance training or the strength training, so I will discuss only the strength training adaptations, and I will not consider the endurance training adaptations here in this lecture. But when we will discuss about the aerobic exercise and the aerobic training or the endurance training, then I will tell you about the endurance training adaptation. That is in most probably chapter number 9 or 10. Chapter number 9 probably. Okay. So we will discuss endurance training adaptations over there. So let's start with the strength training adaptations. What are the strength training adaptations? So when you have incorporated a person into the resistance training program, and how the muscle or the muscle system will react. First of all, the first point is that when a person is undergoing the strength training program, there is hypertrophy of muscle fibers. So individual muscle fibers hypertrophy means that the overall muscle fibers and the overall muscle size and the overall cross section area will be increased as a result of hypertrophy of single muscle cell. and this hypertrophy is always greater in type 2 or fast twitch fibers. There is hyperplasia muscle fibers, but hypertrophy is always prominent in strength training adaptations, and hyperplasia is not so much prominent. And fiber type composition, remodeling of type 2b to type 2a occurs, and there is no change in type 1 to type 2 distribution. Okay, so capillary bed density, it it undergoes no specific change, and mitochondrial density and volume, they also does not go any change. So hypertrophy of muscle fibers is the key point of this slide. Okay, always remember there is hypertrophy of single muscle cell, and eventually the whole, as these all these muscle fibers are, they are single unit of your muscle cell. So in the case of aggregate hypertrophy of the all muscle fibers, it will increase the muscle cross section area, the muscle mass, and the eventually the development, or the muscle strength or the muscle power. Motor unit recruitment is increased, and motor unit firing, the firing rate is also increased, and synchronization of firing is also increased. Okay, what are the changes on the metabolic system? The previous one, the changes on the muscular system. What are the changes on the metabolic system? ATP and creatine phosphokinase storage is increased. Myoglobin storage is also increased, and stored triglyceride. What are the mechanism of the on that? That is not known. Okay, so ATP and CP storage are increased. As far as enzymes are concerned, obviously more energy production, more enzymatic utilization, creatine phosphokinase enzyme activity increased, and myokinase activity also increased. Always remember, when there is muscle strength is increased, when there is increase in the muscle fiber size, then there is always decline in the body fat. Lean body fat is increased, fat free mass is increased, while percent body fat is always decreased, and this is always one of the most important benchmark of the resistance training. Tensile strength of tendons, ligaments, and connective tissue in muscle is also increased. And as far as the bone mineral density is concerned, this is also increased, or there is no change or possible increase in bone mass, but this is not evident through literature, and still researches are going on. Okay, so as I told you, first of all, I told you about the skeletal muscle structure changes. Always remember, there is hypertrophy and there is less dominant hyperplasia. Type 2b fibers are converted into type 2a fibers, and no as such change in the capillary bed density or in the mitochondrial density of the muscle fiber cells. As far as the neural system is concerned, motor unit recruitment is increased, and rate of motor unit firing is also increased. In the metabolic system, ATP and creatine phosphokinase storage is increased, myoglobin storage is also increased, enzymatic activity also increased, and as far as the body composition is concerned, the lean fat-free mass is increased while there is decrease in body fat. Okay. Also, about the connective tissues, tensile strength that is increased, and there can be probable increase in bone mineral density, and no change in the bone mass. Okay, so this is about the physiological adaptation, that what are the changes that the muscular system, the neural system, the metabolic system, and the the energy storage and the enzymatic activity is influenced by the utilization or by incorporation of the resistance training program. So this is a very important topic. The next one. Now we are starting with the determinants of resistance exercises. As you know that when we discussed stretching exercises, when we were discussing range of motion exercises, I told you about the determinants. What are the general determinants? They are always the determinants are basically they are the factors that design and that guide you about the whole procedure, that what must be intensity, what must be the alignment, what must be the patient position, which area must be stabilized, and you know and what kind of what kind of mode you should use. So this is the list of determinants that we will see over here. And they say that in the determinants of resisted exercise, many variables make resisted exercise program more effective and safe to use. That principle is again coming over here that it elements specific to patient's desired function goals. We have discussed that principle in the lecture number one of this chapter. We will see about the submaximal versus maximal versus maximal exercise loads. Also, determinants depends upon a number of factors, which we will see in the upcoming slides. And they are saying that you must utilize the concept of low resistance training in rehabilitation programs than in the conditioning programs. Obviously, the conditioning program is always for the clients, while the rehabilitation program is always for the patients. So you must be differentiating. You must be in a position to differentiate the determinants of conditioning program as well as of the rehabilitation program. Okay, the conditioning program can be any physical therapy program, any sports exercise therapy program, anything where the clients wants to improve their fitness or they wants to improve their strength or the performance, while in the rehabilitation program you have to gradually increase the performance of the muscles. Okay, so this is how you have to consider the change and the difference between the determinant selection. Okay, first they are also saying that you must consider the submaximal loading. Always remember that we always proceed the intensity or the load from the low, moderate to the high intensity. So this is a very common progression of the intensity. This is not new for you. At the beginning, to know the response in the early stages of soft tissue healing, you must go for the low intensity there. This thing, as you have we have discussed this thing in the range of motion as well. After periods in immobilization, connective tissues are weak, so you should go to the low intensity, and you have to improve the muscle endurance as well. And you must utilize the concept of the rest interval in which you can go for the warm up. You can ask for some stretching exercise in the warm up period, and you can give them time for the cool down as well. So this is a very common, the guidelines which you have been familiar in the stretching exercise as well. Still, I have added this over here. So the first determinant of the resisted exercise, this is the first one, is always alignment. In the resistance program, the procedure will be again the same. There will be first we will design, or we will define the patient position. Then we will define the therapist position, the second one. On the third one, we will define the alignment and the stabilization. Does we need it? Or we need any stabilization, or alignment must be changed or not, or it must be same. And in the next, they will be, command to the patient if you want to give, or any advice to the patient if you want to ask him, or anything else you want to ask him. And then there will be the application, what how you will conduct the resistance training program. Obviously, you will be putting some resistance, some load, something that will be imposing some kind of resistance on the muscle. But still we have a number of topics to see this. So let's define the determinants first. So what is alignment? Alignment is always, the position of the body segment. And what is the concept of using alignment? This is always to strengthen a muscle and to avoid substitute motion. This is determined by direction of muscle fibers and the line of pull of the muscle, and the position should replicate the action of the muscle. Obviously, this is the position of the body. And alignment and gravity, they say that this is important when body weight or free weights are the source of resistance. Okay, as they have added it here, so let's just talk it about the sources of resistance. You can apply the resistance via two forms. Either you can go for some manual resistance, or you can apply the resistance through your hand, or you can go for some mechanical resistive devices. Very simple. You can apply some, you can tie some cuff weight in which there is a lot of weight. There can be some sand. You can use some sandbag, or you can ask him to grasp a dumbbell, or you can ask him to carry a weighted ball. So a number of things are there. You can use pulley. You can use some theraband. So a number of resisted equipments are available in the market. So Either you can go for the manual resistance or you can go for some mechanical resistance. So alignment is always important when body weight or free weights are the source of resistance. Patient should make muscle being strengthened and act against the resistance of gravity and the weight. Resistance training is always done in the person whose muscle strength grade is always 4 plus. Okay, so patient must execute an activity against the gravity plus against the additional weight that is the resistance. Okay, that additional weight, that additional resistance, that additional intensity, they all are basically the resistance through which the muscle will encounter that additional resistance, and then those physiological adaptations they will be eventually produced in the muscle. And always remember, after the consecutive period of resistance training, minimum after 2 to 3 weeks, the hypertrophy starts appearing. And hypertrophy, it is always evident, or it is always at peak within 4 to 8 weeks. Okay, starts appearing at the second or the third week of the continuous resistance training, and this is always obvious in the fourth to eighth week of the resistance training. Okay, with the hypertrophy. Here comes the stabilization. Obviously, it is always important to maintain a stable, to do the stabilization of the distal or the proximal segment. If you want to stabilize, if you want to do some movement, or you want to ask him to do the isotonic contraction along with the weight of the elbow, then you will ask him to stabilize his or her shoulder. Okay, so to maintain appropriate alignment, ensure the correct muscle action and movement pattern, avoid unwanted substitute motions. In order to localize a movement, you can go for the stabilization of the distal segment or the proximal segment as per requirement of the exercise. Available surface like firm treatment table, you can go for you can go for supine lying position whenever possible. You can also use the body weight in horizontal position, and usually stabilization is done of the proximal segments, and sometimes the distal attachment is always stabilized, but that depends upon the requirement of the exercise. Okay, so this is about the stabilization. So far we have discussed two determinants. First one is the alignment, that is the position of the body or the body segment which we want to deal with, and the second one is stabilization, that is maintenance of the the subsequent distal or the proximal segment. Okay. Then comes the concept of external stabilization or internal stabilization. What we do in the external stabilization, this is done by manually by the therapist with the patient or with equipment. For example, you can use any belt to tie that limb or the segment. You can use any strap to tie that portion, or you can ask him to grasp through that the couch, through the end of the couch. You can ask him to, you know, to uh, to keep your hand around the edge of the couch. So you can use any surface for the external stabilization. What is the internal stabilization? You can ask the patient to isometrically contract the adjacent type of adjacent area. So internal stabilization is always done by isometric contraction of adjacent muscle group, not affecting movement pattern but holds the body segment of the proximal attachment of the muscle. For example, you just ask him to contract your adductors. Okay, and now this is the internal stabilization. I'm not using it, but if what if I do, if I tie some some strap or some belt over here along with the edge of the couch, that would be the external stabilization. But if I'm doing the voluntarily, if I'm voluntarily doing the stabilization by the isometric contraction of the muscle, that will be the internal stabilization. Okay, then comes the load or intensity or the force. So intensity is always the amount of resistance or the weight or load or stress or the exercise load imposed on the contracting muscle during each repetition of the exercise. Here you have to utilize the concept of the overload principle. Overload a muscle, progressively increase the intensity of exercise, intensity of weight will increase progressively, and progressive increase in intensity will lead to gradual increase in the amount of resistance, and intensity also depends on other variables as well. Okay, so what is the concept of maximal or the near maximal loading? They say that in the high intensity exercises, we use them to increase muscle strength and muscle power and to induce the concept of the hypertrophy. In the rehabilitation program after a musculoskeletal injury for returning to high demand activity, but when only when the patient has reached a maximum level or at the some maximum level in the conditioning program you can go for that, and the training for the weightlifters and for the bodybuilders you can utilize the maximum loading only in the conditioning program, but in the normal patients and the patients who is undergoing the resistance training program you have to gradually increase the intensity. Okay, intensity should never be too high and take it in consideration the cardiovascular. This I will tell you in the precautions of the resistor exercise what the patient is doing. You are applying the force. The patient is also applying the force, and what he do, he will do the execute. He will do execution of the Valsalva maneuver. What he will do, he will basically inspire a lot of gas, a lot of air, and he will like to put the force via increased abdominal pressure because he has inspired so much. And what will be the the harmful effect? It can lead to increase in the pressure in the thoracic cavity as well. That is not good for the patients, for the ischemic heart disease patients, for the elderly patients. So I will discuss about it in the precautioning portion, precautioning measures, and we will discuss initial level of resistance and documentation of training effects is always important, and it is always difficult to judge with manual resistance exercises that how much force is being applied. So this is the basic, a side effect or disadvantage of using manual resistance. We can put the force according to the tolerance of the patient, but we cannot measure that force. So mechanical resistance has a advantage that the resistance is always applied quantitatively or it is always measurable. What is the repetition maximum? The maximum force a person can, the maximum weight a person can, lift. That is always the repetition maximum in. And what is the concept of using the repetition maximum? This is used to document a baseline measurement of the dynamic strength of the muscle, to identify the exercise load to be used during exercise for a specific number of repetitions. So always they say that you can use one repetition maximum or 10 repetition maximum can be used, but one repetition maximum is not safe in the same condition if there is phenomena of fatigue. Okay, so the maximum weight that a person can lift, that is, or the person can withstand, that is the repetition maximum. So you must uh, take consideration of repetition maximum as well in the baseline measurement when you are going for the isometric type of uh, muscle resistance exercises. They're also saying that you can determine the baseline strength as well as by using two devices. This is a cable tensiometer. This is actually an accurate instrument which tells you about the amount of tension produced very accurately. That is a cable tensiometer, but this is not currently in practice. Or you can go for handheld dynamometer. What it does, handheld dynamometer, when you take it in your hand, and usually you take it in your hand with the shoulder adducted and elbow 90-degree flex, and you take it into your into your hand, or you're using the wrist muscle, then you want to push that. There is a rim over here and you want to push that rim, and how much forcefully you are pressing that rim. When you are pressing that ring, there is a dial in the center. You can see over here when you are pressing that, the dial will be taking some argument, and if you're pressing it more strongly, then the dial will take the more number. So this is how you can also go for the quantitative measurement of the strength, but only of the muscles of the hand. Okay. Then comes the training zone. They're saying that the amount of resistance used is calculated as a percentage of one repetition maximum. At the beginning, obviously, the percentage is low for sedentary and untrained individuals, and gradually it will be increased, and gradually it will be taken up to the 80% or the 95% level. But in the healthy and untrained person, you can go for the 60%, the 70% of the maximum weight that he or she can lift. Okay, So if a person can, for example, if he she can carry 20 kg per repetition maximum, then you have to go for the only the 60 to 70% in the healthy but untrained person, but only for 30 to 40% in the untrained but physically very low person. Okay, the lower percentage of this range is safer at the beginning of the program. Okay, this is important for the safety point of view. But in the children and the elderly person, low to moderate percentage you have to use. With significant deficits in muscle strength for muscular endurance, use a low load, possibly at 30% to 50%. Okay, so what is the volume of the exercise? You are familiar with the concept of the frequency, you're familiar with the concept of the sets of exercise. If we add all the sets and the frequencies into one category, there is always the volume of the exercise. The total number of repetitions or the frequency and sets during a single exercise session multiplied by the resistance used is known as the volume of the exercise. And always remember there is inversely proportional relationship of volume with the frequency or the number of repetitions exercise. Okay. Number of muscle contractions against a specific exercise load, that is the frequency of the repetition. The average untrained adult exercise at 75% of one repetition maximum will do 10 repetitions, while at 60% intensity he will do more repetitions, and at 90% intensity he will go for the 45 repetitions. This is the same concept I have told you in the um, stretching, where we do it intentionally, where we are prolonging the time, we are increasing the time and we are decreasing the intensity. Similarly, there we decrease the intensity and increase the frequency. So this is the same concept you can do. If you decrease the load, then you can go, the patient person can go for the more frequency or the number for more number of repetitions. Okay. um, Okay, they're again discussing about this thing. Greater strength is will be coming in 2 to 3 repetition maximum to 15 repetition maximum. Okay, okay. Here comes the sets. What is sets? Number of repetitions. If they are grouped together, they are known as the sets or the bouts. And after each set of a specific number of repetition, there is brief interval of rest. 1 to 6 sets can be used in single set exercise at low intensities, are used in early phases of resistance training program or in a maintenance program, while multiple set exercises are used for progression and they are of superior level obviously. Then also they say that current recommendation is that exercise load that causes fatigue after 6 to 12 repetitions for 2 to 3 sets is there. Okay, and you can increase the level of resistance gradually. Exercise order, what is that? The sequence of exercise, impact on muscle fatigue, and the adaptive training effects. So, large muscle group exercise before small muscle groups, and multi joint muscles before single joint muscles, plus high intensity exercises before low intensity exercise. So, in the exercise order, always prefer the exercise of the large muscle groups and the multi joint exercise and the high intensity exercise before, then the small muscle groups, then the single joint muscles, and then the low intensity exercise. Okay. What is frequency? Number of repetitions, number of exercise sessions per day, per week. The greater the intensity, the greater the volume of the exercise, more time is needed between exercise sessions to recover from the temporarily fatiguing the effects of the exercise. And a common cause of decline in performance is excessive frequency, inadequate rest, and progressive fatigue. And some forms of exercise need less frequency and greater recovery time. For example, in high intensity eccentric exercises. They also say that in start short session of exercises can be performed on a daily basis several times per day. And as the intensity and the volume of exercise increases, every other day or up to 5 exercise sessions per week you can go. Again, reduce for a maintenance program, usually 2 to 3 times per week for children and elderly person. What is the recommendation? That you can go for 2 to 3 sessions per week, and for the athletes and bodybuilders, obviously 6 days per week is necessary. What is the total time of the exercise, duration, total number of weeks, days, months for the exercise, the duration. It depends upon the cause of the impairment and the requirement of the client. And for significant changes like hypertrophy or increased vascularization, at least 6 to 12 weeks of resistance training is required. This is minimum. And always remember there is a concept of reversibility training. So you have to continue these exercises in order to maintain the changes that you have that you have acquired from the resistor exercise. What is the rest interval? The interval between the sets. This is necessary to allow time for recovering from muscle fatigue or exercise-induced delayed onset of muscle soreness. In order to minimize the fatigue phenomena, integration of rest into exercise is always advisable. This is dependent on intensity and volume of exercise. If that will be high, you have to give more rest time. For moderate intensity resistance training, a 2 to 3 minutes rest period after each set you can go for. But if you are using 4 to 5 minutes exercise session, exercise interval you are giving, but with the high intensity you have to increase that. Pathological conditions causing fatigue, children in the elderly person, you have to give rest interval for at least 3 minutes between sets by performing the unresisted exercises, such as low intensity cycling or performing the same exercises. But always remember that active recovery is more efficient than the passive recovery, and at moderate intensities, we always require 48-hour rest interval. What will be the mode of exercise? Mode of exercise, you can go for the uh, manual type of exercise, you can go for mechanical type of exercise, you can go for the isometric exercise, you can go for the isotonic exercise. A lot of exercise are there, and we will discuss them in this chapter in the upcoming lectures. So type of muscle contraction, manner in which the exercise is carried out. Isometric in the static, we can go for the static isometric contraction. You have to just press it out, and there must be contraction in the muscle. And you have to do this movement like this. Okay, so you can go for the isometric and isotonic exercise as well, or you can go for the isokinetic contraction of limb, isokinetic contraction as well, where you have to take the consistent velocity, but for that you need a rate controlling device. So these are the type of exercises you can go for. And the last thing we have to discuss, you can also go for the open chain exercise or the closed chain exercise. You want to do this exercise, this is the open chain exercise. You want to do this exercise, this is the closed chain exercise. So these are the modes of exercise. So far we have discussed about a number of determinants that we have to consider during the designing a resistance training program. Either you are supervising a rehabilitation program or you are supervising some conditioning program. So these are the determinants you have to take consideration of them, and these factors are very much important. So always consider these points whenever you are designing some program for a person or for a patient. So inshallah next time we will continue the chapter from here. Thank you.